Good evening, everyone. Here we are discussing the most important MCQs asked in AIIMS, Norcet, and all the other competitive nursing exams. So let's start. The first question is: a client diagnosed with valvular heart disease is at risk for developing heart failure. What should the nurse assess as the priority when monitoring for heart failure? The option A is heart rate, option B blood pressure, option C breath sounds, and option D activity tolerance. The right answer is option C. Move on to next question. Most common clinical features seen in trigeminal neuralgia. The option A is facial pain, option B diarrhea, option C constipation, and the option D diaphoresis. The right answer is facial pain. Move on to next question. The complication of toxic shock syndrome is option A pulmonary embolism, option B liver failure, option C renal failure, and option D all the above. The right answer is option D. Move on to next question. Which is the somatoform disorder? Option A hypochondriasis, option B conversion disorder, option C pain disorder, and option D all of the above. The right answer is option D. Move on to next question. A person is unable to enjoy pleasurable events in the life is termed as option A anhedonia, option B ataxia, option C alexithymia, and option D aphonia. The right answer is option A anhedonia. Move on to next question. Question number 6. A client is hospitalized for ingesting an overdose of acetaminophen. The nurse prepares to administer which specific antidote for this medication overdose? Option A phytonadione, option B flumazenil, option C N-acetylcysteine, and option D naloxone hydrochloride. The right answer is option C. Move on to the next question. Okay. Question number 7. How to restrain to a violent psychiatric patient? Option A. Restrain only the hand. Option B. Restrain both hands with opposite side of bed. Option C. Restrain both legs. Option D. Restrain both hands and the legs. So the right answer is option D. Restrain both hands and legs. Move on to the next question. Question number 8. Which of the following is the most common adverse effect of altiplase? Option A headache, option B weight loss, option C epistaxis, and option D hypoglycemia. The right answer is epistaxis. Question number 9. While catheterizing a male patient, the nurse observes blood around the meters. What action should the nurse would take? Option A insert the catheter, option B clean the blood and insert the catheter. Option C inform to the doctor. Option D lubricate with anesthetics jelly. The right answer is inform to the doctor. Option C. Question number 10. ABG report of a patient is PCO2 is 31, bicarbonate is minus 21. No, it's printing mistake. Bicarbonate is 21. pH is 7.43. What would be the possible acid base imbalance? The option A compensated respiratory acidosis, option B compensated respiratory alkalosis, option C uncompensated respiratory alkalosis, and option D uncompensated respiratory acidosis. The right answer is option C. Move on to the next question. Question number 11. In risk fracture, which type of respiration pattern seen in a patient during respiration? Option A, pain during inspiration. Option B, deep and rapid respiration. Option C, paradoxical respiration. And option D, pain while expiration. The right answer is option C, paradoxical respiration. Question number 12. Which layer of the skin is involved in cellulitis? Option A, hypodermis and dermis. Option B, epidermis and dermis. Option C, dermis. Option D, affected epidermis or dermis due to Staphylococcus aureus. The right answer is option C, dermis. Next question. Class 2 antipsychotic drug act as what? Option A, serotonin inhibitor. Option B, dopamine antagonist. Option C, epinephrine antagonist. And option D, acetylcholine antagonist. The right answer is option B, dopamine antagonist. The next question. A patient is having multiple scratches at his veins. The patient may habituate to which drug? Option A, LSD. Option B, cocaine. Option C, phencyclidine. Option D, opiates. The right answer is option D, opiates. Which type of lens is used to correct myopia? Option A, concave lens. Option B, convex lens. Option C, bifocal lens. And option D, cylindrical lens. The right answer is option A, the concave lens. Hyponatremia with hypovolemia would be seen in which condition? Option A, congestive heart failure. Option B, nephrotic syndrome. Option C, liver cirrhosis. And option D, all of the above. The right answer is option D, all of the above. Next question. The assessment of hypothyroidism diagnosis would be done by option A, neck inspection. Option B, thyroid auscultation. Option C, seen facial feature. Option D, perform thyroid gland assessment. The right answer is option A, neck inspection. A patient comes in emergency ward with snake bite. What would be the first nursing priority intervention by the nursing officer? Option A, keep the patient's extremities below the heart level. Option B, take patient to the safer side. Option C, remove jewelry and clothes. Option D, immobilize affected extremity. The right answer is option B, take patient to the safer side. Next question. Which of the following is the largest cranial nerve? Option A, cranial nerve 6. Option B, cranial nerve 10. Option C, cranial nerve 7. And option D, cranial nerve 5. The right answer is option D, cranial nerve 5. Which of the following are the hormones of the anterior pituitary gland except option A, TSH, option B, GH, option C, ADH, option D, prolactin. The right answer is option C, ADH. Early sign of cataract include option A, float formation, option B, halos formation, option C, blurred vision, option D, pain. The right answer is blurred vision. Which mental illness is linked to hypothyroidism? Option A, depression, option B, delirium, option C, mania, option D, cognitive dysfunction. The right answer is option A, depression. Which antigen involved in hepatitis B transmission? Option A, surface antigen. Option B, core antigen. Option C, anti-hepatitis B antigen. Option D, HbSAg. The right answer is HbSAg. A client with pregnancy induced hypertension admitted for C-section. Before the surgery, the nurse should keep the client in which position? Option A on her right side, option B supine with a small pillow, option C on her left side, option D in semi-fallows position. The right answer is option D in semi-fallows position. Which is the confirmatory test of TB? Option A sputum culture, option B chest X-ray, option C Montex test, option D PFT. The right answer is option A sputum culture.